we're gonna just ingrain this in your head, radiation protection, radiation protection, radiation protection, okay? So we're talking about protecting our patients, we're talking about protecting us, we're concerned with those who are in the childbearing years, right? Because when we're shielding a patient, are we protecting the patient, or who else are we protecting? Huh? Not only ourselves, but who else are we protecting? When we're covering the gonads, are we protecting our gonads?
The future generation.
We're protecting the future generation. See, now you guys remember, right? So we're protecting those in the present, but we're also protecting those in the future. All right? So, selection of exposure factors. All right, selecting the appropriate kilovoltage. Kilovoltage refers to the penetrating ability of the X-ray beam. Okay? kV applies to the penetrating ability of the X-ray beam. The thicker, the more dense the body part, the more kV that we use. Okay? kV is based on body part thickness. So if I wanted to X-ray my fingertips, do I need a lot of kV or do I need a little bit of kV?
A little bit.
A little bit of kV. So I'm probably going to be about in the 40s or 50s on my fingertips. What about my wrist? Is it the same thickness as my fingers? So I'm going to increase my kV, maybe about 2 or 3 more. It increases as the body part gets thicker. So I'm talking about maybe 40, 50 here, but by the time I get to my shoulders, I'm about 60 to 70 now. And then when I get to my chest, it's going to be, how's my chest? It's going to be about maybe about 110, 120. You guys understand? Okay? So kV is based on body part thickness. And then MA in time applies to quantity or the amount of X-rays that you are going to need to produce a radiographic image. So these are all the factors that we manipulate. The 3 major factors, kV, MA, and time. We're going to train you, hopefully, the correct way in how to select your parameters for a given type of procedure. It will be reinforced when you guys start your clinical practice out in the field. Patient instructions. Again, we're talking about radiographic examination. Patient instructions. We're not just pushing buttons, guys. We are trying to create a relationship between the tech and the patient so we can go through the procedure without any type of problems or complications. Patient instruction is a key element in getting through the examination. Okay? And then processing of the image receptor. Good thing for digital imaging now, because everything is done in the open, under a light. You just drop the cassette and you go. And your image comes out in 20 seconds or less. Isn't that great? It's wonderful. All right, the anatomical position. The anatomical position. We need a point of reference when we are taking X-ray exam and we're discussing positioning. You always have to place your patient in an anatomical position as a point of reference. And an anatomical position is you facing forward, palm facing forward. Okay? And if I weren't standing, it would also mean that my toes were pointing down, heel up. Okay, I'm on my tippy toes. Toes pointing down, heel up is your anatomic position. Okay? So once we have a point of reference, now we can talk about other types of radiographic terminology. Okay, so in an anatomical position, we'll talk about the different planes of the body. Okay, the division of the body. First one here is sagittal. Sagittal is number 1. Okay, sagittal is number 1. Sagittal divides the patient or the body part into left and right halves. Let me take that back. Left and right parts. Because half is equal, right? Okay? So pay close attention to how it's described. If it's sagittal, we're dividing it into a left and a right. If it's mid-sagittal, what does that mean? Equal left and equal right. All right? Coronal divides the body or the part into front and back parts, or anterior and posterior parts. Again, look carefully at the terminology. If it's coronal, it's just front and back. If it's mid-coronal, now we're talking about equal front, equal back. Yeah? Oblique. It's a longitudinal or transverse plane that is at an angle and not parallel to the sagittal, coronal, or the horizontal planes. That is number 3. And then you have your horizontal, also known as the axial plane, which divides the body into top and bottom portions, or superior and inferior portions. Okay? Now if I say mid-axial or mid-horizontal, again, equal top, equal bottom. Okay? So training how you look at things, you have to look for those key words, because adding one of those keywords or omitting one of those keywords changes the definition entirely. All right? All right, so here we have some sectional images. Here we have sagittal. Okay, left and right parts. Axial cross-sectional, or horizontal, top and bottom. Coronal, front and back. Questions? Okay, these are some other types of planes that we'll talk about later. There are many other planes that we deal with when radiographing certain anatomical structure. One is going to be the skull. So I'll just introduce this to you now, and we'll talk more about it specifically later on. But another plane that we use here is what's known as the base plane. Another name for this base plane is the anthropologic plane, or the Frankfurt horizontal plane. And this is an imaginary line that goes from your infraorbital margin, right below your orbits, into your EAM, or your external auditory hiatus. We use this imaginary line to position the skull in certain ways when we're taking x-rays of the cranium, the bony calvarium, or the facial bones. Remember, we're three-dimensional. So we use this plane to get it either perpendicular to the image receptor, 30 degrees to the image receptor, 15 degrees, and then we also have a mid-coronal plane that we have to use in obliquing the patient's skull in a certain angle, and then angling your tube in a certain angle to get that structure in true profile. You thought you just threw a patient on the table and took pictures, right? If it were that easy. If it were that easy, but you have, when we say positioning, you have to physically position your patient to get the right angles, to get that structure in true profile. Okay, another imaginary plane here is the occlusal plane. It's a horizontal plane between the upper and lower teeth. Just for an example. All right, so based on the anatomical position, okay, you have your posterior surface, also known as the dorsal surface. This is what you're going to get out of this, is to describe the same thing, there may be 2 or 3 different words, 2 or 3 different terminologies. Okay, welcome to medicine. Okay, so the posterior surface is also known as the dorsal surface, which includes the bottom of the foot. Now the bottom of the foot is either called the dorsal surface or plantar surface. The anterior surface is also known as the ventral surface, and the top of the foot is known as the dorsum pedis. We use the dorsum pedis a lot, or just simply dorsum. That is the anterior or ventral surface of the foot. Always got to imagine your patient, your starting baseline point is the patient is in a true anatomical position to understand the terminology that we're talking about, okay? All right. So the back of your hand is the dorsal, okay? Isn't this, I thought this was the front of the hand.
Not an anatomical position.
An anatomical position. The back of your hand, posterior anatomical position, and your palmar surface is anterior. Okay, the palmar surface is the anterior portion or anterior surface of the hand. Okay? All right. You guys ready? Radiographic projection. The projection is the travel or the pathway of the X-ray beam. It is the pathway or the travel of the X-ray beam. So, when we're talking about this particular procedure here, we are going to describe the projection of the X-ray beam from where it enters to where it exits. So in this case, this projection here is known as a postero-anterior projection or a PA projection. Do not confuse this with position, which we'll be talking about here in just a moment. This is a projection, the travel of the X-ray beam from where it enters to where it exits. Therefore, this is called a PA projection. Now, if the X-ray beam entered my anterior surface and exited my posterior surface, what is that called? Antero-posterior projection, or AP for short. This is a PA projection, this is an AP projection. Okay? Got that? Then we have an AP and PA oblique projection. So, first of all, let's talk about the projection here. The X-ray beam is entering which surface? The anterior or posterior surface?
Anterior.
Anterior surface and exiting the
Posterior.
posterior surface. So this is an AP projection. Okay, AP projection. What was that other one you said? Plantar dorsal? Dorsal plantar.
I think dorsal.
Okay. Dorsal plantar projection. Yeah, if you want to get complicated. But yes, that also applies. All right? And then here, what surface of the hand is it entering? The front or the back?
Back.
Anatomical position, remember that. It's entering the posterior surface of the hand and exiting the anterior surface. And now, what kind of projection is this?
PA.
It's what?
PA.
PA. Posterior, anterior projection, or PA. Now, it's neither flat or on outside. The body part is in an oblique position. An oblique position. So when we are describing this particular position here, we're going to describe it in two steps. Firstly here it's an AP projection, but it's an oblique position. When we're talking about position, we're talking about the actual position of the anatomical structure. Don't get that confused with projection. Projection, we're talking about the X-ray beam travel. Position means the actual body part position. Okay, so here we have a AP projection. It's in an oblique position. So it's neither flat or on its true side. It's somewhere in between. It's oblique. Now, to describe this obliquity, we need a starting point. So for the foot, our starting point would be plantar surface down, foot flat. You guys with me? Foot is flat. So there is a rotation towards my middle. Okay? The knee or the knee and the foot is rotated towards the middle. Here is your middle. Okay? This is your medial portion. This is your lateral. This is medial, this is lateral. Okay, so it's being rotated medially. So therefore this is called a medial oblique. medial oblique. Okay? With the hand, again, we need to describe the obliquity. Which way is it going? So from the palmar surface down, which hand am I using? Oh, this hand, okay. Palmar surface down, which way did I turn my hand?
Laterally, away.
Laterally, away from the middle. So this is a lateral oblique. Okay, a lateral oblique. Okay. I'm going to throw in some extra words in here. You guys ready? You guys ready?
Yeah.
Okay. This is medial. Okay. It's also known as internal. So this can also be called an internal rotation. So medial rotation or oblique is also known as an internal or internal rotation or internal oblique. So if this is internal, this is what? External. This is an external rotation or an external oblique. Any questions? Okie dokie. All right, so let's look at the elbow here. Your point of reference here for this particular extremity is we're going to go back to the true anatomical position. What's your true anatomical position?
PA.
Palm up, right? Okay, so now look what happens. How is his hand positioned?
Palm down.
So which way did I turn or rotate my arm and elbow?
Medial.
Medial oblique. Okay, so this is a medial oblique.
Okay, so you use the elbow for anatomical positioning, but you don't use your foot or your hand. Right?
Yeah, so that was the exception. So that's why I jumped a little bit. So when we're talking about the hand and the foot, you got to start with the palmar surface down for the hand or the plantar surface down for the hand or the foot. Those are the exceptions. Now for these other ones that we're talking about here, you got to start in the true anatomical position. Okay? So for the elbow, we're not talking about the hand, we're talking about the elbow. Starting in a true anatomical position, we are turning the palm down, which is going towards the middle or internal section. So this becomes a medial or internal oblique of the elbow. Okay? True anatomical position for the knee. What type of oblique is that?
Lateral.
Lateral or
External.
external oblique or rotation.
Of the hip, not the knee though.
No, this is of the knee. Because in the knee, in true anatomical position, my knee is facing you, like so. Okay? And now I turn my foot outward, which rotates the knee outward in a lateral or external oblique from a true anatomical position, knee facing you. Medial oblique, lateral oblique. Okay? Okay, lateral projection. We're talking about projection. Okay, projection refers to what? The travel of the X-ray beam. Okay? So here we have the X-ray beam entering the medial surface and exiting the lateral surface. Therefore, this projection is a medial-lateral projection. What position is the patient in? What position is that body part? It's a lateral. It's on its side. So to describe the study, it's a medial-lateral projection, lateral position. Okay, so it's a medial-lateral, lateral. Medial-lateral, lateral. Okay. What about the wrist? What surface is it entering? True anatomical position.
The posterior.
No, it's on the side.
Oh,
So
lateral.
it's entering the which surface? lateral surface exiting the
Medial.
medial surface, so therefore this is called, what's the projection?
Medial, lateral.
Lateral.
Lateral, medial.
medial projection. What position?
Medial.
No, it's a lateral position. It's a lateral position. So projection is lateral medial projection, lateral position. So we talk about in terms of projection and position. Is it here? There you go. Huh? What's the question?
I guess I'm confused because if we're moving this way, would we be moving medial?
No, I'm not talking about obliquity now. Obliquity, okay, so obliquity is specific for which way you are rotating the anatomical structure.
Oh, okay.
This is just plain old true lateral. Just a plain old lateral position. So I'm not talking about, remember obliquity is neither straight forward or on its side. Here this is straight on its side. So we're not gonna talk about which way did you turn it. Which way did you rotate it? That only applies to oblique positions. Okay? Now, with that said, in a true anatomical, this is a true anatomical position. Okay, again, describing the thumb side as the lateral, that is the side that is entering, is the lateral aspect in an anatomical position. See, my thumb is on the lateral side. Okay, place on this position, it's entering the lateral, exiting the medial. Okay.
So with the hand in the foot, we only take that consideration to the oblique? Because if say the X-ray was just like up to like your knuckles,
Mm-hmm.
that wouldn't then be the ones that we did with the oblique. We wouldn't be considering this like the X-rays, like we would be referring to this as the top of the body.
Right, so that was the other thing too. Okay, I'm gonna rewind here a little bit. Because it was oblique, okay, back here, because it's oblique, remember how we were talking about AP and PAs? Because on this particular one here, because it's oblique, so again, it only doesn't apply to the hand and the foot. The hand and the foot are exempt from these rules. Okay, so let me get that out of the way. The hands and the foot are exempt from these rules. So the other body parts, like this for example, it's neither AP or PA. Okay, because it's entering like a spot between the front and the side. So this is neither an AP or PA, whereas this is more obvious because it is entering the anterior surface and this is entering the posterior surface. Okay, so these exceptions of obliquity only apply to the hand and the foot. So you gotta start with the plantar or dorsal surface first, plantar or palmar surface first for the hand and the foot. But here, in the other parts of the extremities, it does not apply.
But if you go to the next one,
Okay, so let me go to the next one.
and it say that second X-ray wasn't on the hand, wasn't on the wrist, but it was further up the hand, are we still looking at palmar?
Oh, so if we,
idea,
okay,
or-
so this is a wrist. So if we were taking an X-ray of the hand, it still is a lateral medial projection.
Okay.
Okay, so, yeah, so the question was, well, this is directed to the wrist, what if this was directed on the hand? It's still entering the lateral and exiting the medial. So then that would be a lateral medial, lateral hand.
It's the same.
It's the same thing, but it's of the hand. Same thing with the elbow. When we're doing a lateral elbow, it's gonna be entering the lateral aspect and exiting the medial, and it's a lateral medial, lateral elbow.
So, okay.
We're gonna, yeah, baby steps. This happens all year. You're not gonna get it today. Trust me. Okay, you're not gonna get it today.
No, I understand that, I just.
You do?
Yeah.
Oh, okay.
I just, the palmar and
Mhm.
that thing was confusing, so I don't know if there's different words for that.
No.
I guess the lateral of the foot
No.
and the
Yeah.
hand.
And so again, we'll try to, go through this again over and over again until we understand the terminology. But again, the concepts especially are kind of hard to absorb. Because again, I guarantee you won't know this today. Okay. Sometimes it takes a semester to understand it. All right. All right, so general body positions. We're talking about laying down on your back. This is the supine position. Okay, so if you're laying on your back, what happens when you're laying on your front, face down?
Prone?
You guys know this, it's prone, yeah. No, this isn't a new term, you guys know what prone is, so this is prone. How come I have a question mark there? Okay, so that's prone. Okay. Erect means you're standing up in a true upright erect position, which is perpendicular from the flat surface, this being the floor, okay? So erect. Another term for erect is upright. Again, these are terms used interchangeably. You are going to be with text who uses different terms for the same thing, okay? So we say erect or upright. It's in true perpendicular with the surface of the floor or the ground. Recumbent, it's just a fancy word for laying down. Okay, recumbent is lying down. All right? So, now let's get to the specifics of this patient lying down. Yes, she is lying down, but how is she lying down? Okay? It's a what?
Lateral.
It's a lateral recumbent. Let's take it a step further. Okay? She's lying down on her side. It's a lateral recumbent. But what side is she lying on? Or what? What side? There's two sides, right? We have a left and a right. So what side is she lying on? Right side. So the best way to describe this position is a right lateral recumbent. Right lateral recumbent. Okay? Dorsal is just, yeah, dorsal, okay, so dorsal recumbent is a fancy, again, it's just fancy words. But dorsal recumbent is the same thing as what?
On your back?
Is it supine or prone?
Supine.
Supine. Okay, so ventral, dorsal recumbent is supine. Ventral recumbent is prone, face down. Okay.
We already described the beam that was created.
No. Okay, so the question is, if we were to describe the beam,
Left to right?
it's just this. Yeah, so here comes the nuances. This is just a lateral projection. Lateral projection, lateral position. More specifically, a right lateral recumbent position. Okay?
So if it's coming in lateral and exiting lateral, we just say lateral?
Let's just say it's just lateral. So that was the question. If it's just exiting one, if it's entering one lateral and exiting the other lateral, it's just a lateral.
You're waiting for us to say lateral.
Yeah. All right. Now, what about this? Is this a recumbent?
No.
No. Okay, so recumbent means you're laying down. So this is they're erect or what's the other word?
Upright.
Okay, so that is position. What is the projection?
Lateral.
Okay, it's a lateral upright. Okay, but let's be more specific on what lateral is it. Okay, so here's the key. When you're doing a lateral like so of the abdomen or the chest, here's the other nuance. And we will cover that again in each body part that we take an x-ray of, okay? For the chest or the abdomen, we need to discuss what side or how do we be more specific on the type of lateral or what kind of lateral. And by doing that, you describe it as what lateral side is closest to the image receptor. So in this case, we said this was a right lateral because she is lying on the right side, but it's also her right side is closest to the image receptor. Where's your image receptor? Underneath the
tray.
table, right? And then here we have the wall bucky, so our image receptor is within the wall bucky, right? So what type of lateral is this?
Right.
It's a right lateral. So this is a lateral projection, right lateral
Upright.
upright position. Okay? Everybody got that? All right. Trendelenburg just means head lower than the feet. Fowler, again, this is referring to someone who's laying down. So Trendelenburg, lying down, head is lower than the feet. Fowler's is feet lower than the head. A lot of us can't remember Fowler's. So what do we call it? You're going to hear this out in the field. They don't call this a Fowler's. They call it a reverse Trendelenburg. Because we can remember Trendelenburg, we can't remember Fowler for some reason. Okay? So Fowler, another name for it, is also known as the reverse Trendelenburg.